Afternoon, everybody. Thank you very much for waiting for us to get started there. Welcome to this Great North Care Record HIE update. Delighted, I'm Louise Wilson, I'm Engagement Leader of the Great North Care Record team. Delighted to welcome Jill Watson, who's Project Manager for HIE Delivery, and Dan Sims, who is Head of IT Delivery and Project Director for HIE and Patient Portal. So the aims of the session is to bring you an update on the HIE programme and to take your questions. We'll also be doing a survey. My colleague Catherine Common will be sending you a survey about topics that you'd like to see for the webinar series for next year. Okay, so you've got the mouse there to scroll through the, pass that one on, next slide. Okay, next. Okay, I think we've covered all of that. I'm just going to use that one there. So there are three elements to the Great North Care Record, and that's a slide of our vision, which hopefully everybody is familiar with. And the modular approach is the health information exchange, the patient engagement platform, and the population health management. Now, we're going to be focusing on the HIE delivery today. The population health module that's coming later is really getting into about data and supporting research. But today's focus is about that information exchange for direct care. Okay, so I'll hand over to Dan and Jill, and I'll keep an eye on questions.
Okay.
Over to you.
So, I mean, I suppose we'll just go through the slides. Our priority as a programme at the moment is to focus on the MIG replacement, and we want to try and get that in place by March 2020, which is the end of the contract. For us to be able to make sure that's all in place, we've set ourselves the target of December 19, which gives us plenty of time to give notice for that contract. And there's a number of elements we need to do to meet that requirement. So the primary focus for us is on primary care, which is EMIS and TPP connections. So they're in place now and are beginning to be tested. We're in a really good place with that. And then we're working with our colleagues at NEX to work round practices to make sure we've got sharing agreements ticked and connection settings ticked inside each of those systems. So we'll fully test these first before we do that, and then that stream will start working out. The next component is for everybody who's got a MIG viewer now, to make sure we've got a new viewer for HIE to replace that. The idea behind this is that a lot of systems like EMIS and TPP, and they've got HIE viewers already that we can, the supplier has those and we just turn them on and configure them. We need to test them and then they're good to go. For some of the acute section, the suppliers don't have those yet. So what we've done as a program, so we've put together a basic viewer that is the Cerner viewer that you'll have seen in some of our screenshots before, but we've took some of the hard work away. So we've took the authentication layer and the kind of technical bits to get back and forwards between. So as a simple install that we can do on site in each acute, our tech teams are there to support if anybody has any difficulty with installation as well, and all that does is authenticate with your Active Directory systems. If that's not how exactly you want it to work within your acute hospital, or organisation for that matter, then that's okay. We're going to give you all the code for it as well. So if you want to adapt it or change it, that's absolutely fine. The idea of this is to give a head start so we're not all developing the same viewers. So to be clear, for you've kind of got two options. Either your supplier provides you with a viewer and that already exists from Cerner or your supplier. Fantastic, just use that. That's great. If they don't, we'll be providing this technical pack of here's all the code and the setup instructions to make a generic viewer work embedded within your EPR, or the third and option that we're really not trying to get to, if we can avoid it, is for very small organizations. We can give you the direct viewer from Cerner, which you have to log into each time. So it means you have to manage users and things like that. And for a big organization with tens of thousands of users potentially, it obviously doesn't work at all. If you're a very small organization, then it might be a viable option. But we're trying to avoid that at all costs. And I don't think any of the users of MIG at the moment would be in that boat realistically. The other big stream is the IG work stream. We've got a set of packs of deliverables now. Each of the organisations have supplied an IG lead. Each of those IG leads have either in conjunction or I think 6 of them, is it in total, have stepped up and took ownership of 6 streams, and they're all delivering over the course of the next few weeks. And we've got a pack now that we'll be sending out on a twice weekly basis, that'll show exactly where each of those work streams are up to. So if that IG lead who's delivering it is in your organisation, or you're them, then you'll know exactly where your date is and whether you need to chase someone. So that's all coming out as well now. Okay, I think that's about it for that slide. So the big news is we began connecting the first type organisations. These are the 5 sets that we've picked of, saying, the first set of GPs, which I've already really talked about, a couple of acutes, and a mental health trust, and a council. So that gives us a base to kind of say we know how to connect these types of organisations. We know the technical steps, the operational steps, and then we can just package all that up and share it with everybody else. What this doesn't mean, I've had quite a few questions from people recently, that if you're not in this group, it's not that we're not interested in you and you don't want to make progress. So if you're not one of these and you're another organisation and you want to start working with your supplier to say, how do I connect to Cerner's HIE, we can give you technical packs of what you need to do and what your supplier would need to do. They may already have a connection. There's absolutely no harm in making that progress. For us, we're just wanting to focus on these first as a program to make sure we get that kind of baseline of the what data are we going to share, what's the rules around that data. If we look at results, for example, are we going to show every single result that an acute provides on the HIE, or is it just going to be the last 6 months, the last year, the last 2 years, the last 6 months of a certain type? There's lots of options, and I think that's some of the things we're trying to work through to say, right, what's the model, rather than we all try to figure it out individually, and then we can kind of share that out. So the plan is to get all of those in that first 5 connected by late 2019. We're trying to confirm dates with all of them now. So, for example, our Nuts connection is already being tested now. Sunderland's already being tested. Sunderland acute, that is. And the GP ones, as I've already talked about. The CNTWs and Sunderland Council are just a little bit behind in that process, mainly because of us rather than them. The next step, as I've talked about before, really is the viewers. So we're looking to get all those viewers out there by December, which means we need to get you those packs within the next couple of weeks of the generic viewer, which we will be doing. The generic viewer is finished now. We're just writing the instruction pack, basically, and we're testing it out with someone as well to make sure they can follow the instructions. And then we're producing a plan for the other connections. So that's why a lot of you have been part of the workshops where we're trying to work out what the different capabilities are, who's got what to share, and then what's our targets to trying to connect as many people as fast as possible, basically.
I've just got a couple of questions that have come through, which I think is good timing in terms of talking about deployment and implementation. So one related to information governance arrangements and timeframes about that. And you've mentioned that there are a number of work streams. So when are templates and outputs from those work streams expected?
So we've got a full schedule of work packages. I think rather than me listing them all here, we can just send them out. We'll just list them out, everybody on the webinar, and say which ones, what they are, who's doing them, and when they're due. And that's part of this pack I was talking about. It's going to go out regularly now.
Great. And a note about the MIG that you've mentioned, but Cumbria, the MIG in Cumbria.
Yeah. So our focus as a program is on I suppose what's been termed as the Northeast MIG, but basically the MIG that isn't the Cumbria MIG, I suppose, to try and give it some name that people understand. So that's been the focus, because that's the one that's affected by most organisations who are kind of inside of what we're delivering. The other reason for that is the Cumbria MIG has additional functionality that's been built and is still being being built inside of it. So we're trying to catch up with exactly where that's up to, and just make sure we can cover that. So it'll be the Northeast MIG, and then we'll be moving on to the Cumbria MIG as a replacement. But that date for the March one is the contract end for the Northeast MIG, and that's the one we're trying to replace first.
Thanks, Dan. Next question is a question about finance and money, and what people put into local business cases.
So another regular question I keep getting asked at the moment. Unfortunately, this one's sitting with all the finance directors in the region. So we've gone through the loop a few times now. They're still trying to agree the mechanism and exactly what it's going to look like. I've got the same statement I make all the time, which is that roughly speaking, for HIE, we're looking at about £20,000 per annum per organisation. That's very rough at the moment. That's based on our contract and kind of some basic resource to support it. What it doesn't take into account is, well, what do we want to do as a region to commit to developing it further and things like that. So again, the final number is going to be decided by the directors of finance.
Okay. Next question. Questions are coming in. Please keep sending them in. This is great. Is there a project programme board with representation across organisations that can feed into some of the design decisions out with the current target organisations?
So yes, although I take the question in part slightly. So yes, there's a project board. It is representative of each section. We don't have a representative of every single organisation that is in the project, because that would be 33 individuals, which doesn't really work as a project board. So what we have is a project board with a representation from each section, and multiples where some of those are very big. They then roll up in the regional programme board. So where all the CIOs are represented on there. Underneath that, we have a number of design authorities. So we have the main clinical one that Mark Westwood runs. Its name is PAG.
The Professional Advisory Group.
That's it, yep. PAG. That was the one. So we have that one where we'll be making decisions around what are the rules around what I was talking about before, around what results, how are we going to show them exactly. That's where those decisions are going to be made. We have an IG group work stream that are all the IG representatives from each organisation, and so on and so forth.
Yeah, I think we've always been really keen to take that team of teams approach, and the Professional Advisory Group is a forum of CCIOs, Chief Clinical Information Officers, but extending that to organisational practitioner leads who have a digital leadership role. So if, again, your organisation doesn't have somebody who's a member of the Professional Advisory Group, please do get in touch, because we'd be delighted to speak to them. Okay, so a very specific question about data sharing agreements on the information sharing gateway. And I think you might have answered this one, Dan, about how IG leads will be following up with individual organisations to sign agreements.
Yeah, so we will be using the information sharing gateway that we had in place and put in place for the MIG. We'll carry on with that. It's a really good tool. Everybody seems to really like that as a way to manage things. Again, that's one of our IG work packages. Off the top of my head, I couldn't tell you who's managing that one. But yes, they'll be coming round. And of course, our team will be looking after timing and making sure everybody's signed it when they need to sign it and all the rest of it, and making sure there's no problems there.
Okay, and a clinical content functionality question about the Cerner HIE, about allowing attachments to be viewed. Yeah,
so I'm not sure what that term means, attachment. So there is a section on the HIE where it's, I think it's called clinical documents, where you can put any kind of clinical document, which I presume kind of what the term attachment maybe refers to. The system is absolutely not designed as a download facility, and I think it depends how it's implemented in each setting. But I know certainly in NUTH we won't be having the facility to download it all. Our APR kind of locks that down purposely so that you don't end up with another copy of the data somewhere that now could be out of date. So if we're this isn't about transmitting information. It kind of say it's not like a discharge summary on a clinic. It's not to replace that where they get transmitted from one organisation to the other. It's about an immediate view into the record. So I think if you're looking to download things, it's probably the wrong use case for this product. But certainly if we get a bit of detail from whoever raised that, we can have a look at what that use case is, and maybe it's something that's possible.
Brian, I think you've got email addresses, so please do send in more detailed requirement there, and we'll get an answer to you around there. But I think the language thing is really, really important, because even within teams, sometimes the same language can mean different things, and documents and attachments is that same
Absolutely.
thing. So that will be kind of probably what needs to be dug into a little bit there. Another question, I think this is the last question that I've got to, I've got two more. Has it been more cost effective to replace the MIG with Cerner? That's a question that's come in about that decision around.
So absolutely yes. That's probably the simplest. So remembering, so I can go into all the financials of the MIG costs and all the rest of it, but probably not appropriate for this call. But yes, overall, if you look at the MIG at the moment, allows us to have data just from GP into primary care, and to extend that and keep adding connections in to connect all of the stuff we looked at. They were part of that tendering exercise originally, and the offer was made. And this we picked the most cost-effective option, as well as the highest quality as well.
Okay. Additional data sets are MIG, where people are using additional data sets currently. How will they be accounted for?
So we're going through a process at the moment just to check against the Northeast MIG and what's in HI, and just make sure we're not missing anything. HI is I suppose we term a superset of what's in MIG, so it has the same or more. But we're just triple checking that, because I think there is some developments happened in between us originally signing that contract and where we are today. We know Cumbria, as I referred to before, Cumbria MIG has a lot of additional data feeds in there. Some of them very, very specific, and we don't know whether that's covered or not straight away. So that's again a thing that we're trying to work through. But that's a moving piece at the moment on a weekly basis by the looks of it.
And would HIE access for clinical and administrative staff make summary care record access obsolete?
So we've been having this debate internally within NUTH. I think that is up to each organisation. Realistically, we've come to the conclusion within NUTH is probably. I think we need to just see how users use it first, but most likely they won't end up using it. I mean, we saw that with the MIG realistically as well. When we turned the MIG on, the access to summary care record reduced significantly. So we'll see. It's not that it'll disappear entirely, because of course HI is about this region and summary care record is nationally. So there still will be the reason to use it there. But I think the reduction in usage will be pretty significant.
And I hope that answers some of the question that's come in as well about additional data sets. So where there are additional data sets that people are interested in, maybe across organisations or a particular specialty, I think that's an ongoing conversation between the programme and the clinical networks and the professional advisory group about what's required, and that's an ongoing conversation.
It is, yeah. I think our focus at the moment is let's refine the data sets that already exist with the product, that is, as I say, a superset of what we have in MIG. Once that's in place and we get everybody connected, let's now start talking about extra data feeds. At that point, we're kind of focused on what we've got now and making sure we're going above and beyond what's in the MIG first. Okay.
I'll take these last two questions. Great that so many questions. I think we could do Q&A with Jill and Dan on there.
It makes a much better webinar, I think, questions than me just talking at some slides. Again, picking up that question or the note about attachments, and I think this may be just diving into a little bit more, explaining the definition and some of that language thing about
GPs use Word documents for emergency healthcare plans. If these are not viewable on the HIE, there's a potential effect, noting that this is not functionality of the MIG. And I think one of the things that in that additional functionality about the whole bi-directional view, which primary care don't have at the moment.
Yeah, absolutely. So, I mean, obviously, without knowing the detail, it's difficult to comment. But Word documents, if they're getting uploaded into EMIS or System 1, then we could certainly look to see where that maps to and whether we can get that into the clinical documents tab within HIE. It feels like the obvious home. But I think we just need to look at that specific. I don't think that's something we're going to do now. Realistically, I think that's something we get the connections working, and then we start looking at these, great additions.
Okay. Right, shall we, I've got a couple more questions. Keep coming. Please keep coming in. We've got plenty of time. We've still got half an hour yet. So let's go to the next slide. And if there's anything we haven't covered on there, I think I've got 3 things there just to make a note on. We can come back with more questions. So please keep sending your questions in. So Dan, back to the slide.
Yeah, so I think we've covered everything on this, haven't we, as we've been talking. The only one, I think, is the bottom one, bottom 2 that we haven't covered.
Yeah.
Do you want to talk?
I will. I've got a couple of notes on there. One, just to note that we have been as a team to the CCG Digital Leads meetings. Again, one of those team of teams approaches. Jill and I were at the group last Friday. Was that last Friday? Yeah. And are visiting CCG Digital Leads for one-to-ones to really get into the detail of what's needed, how can we support, and how can we work with CCGs around technical and broader readiness for this. So if, again, we haven't been to see you, please let us know, or speak to your own CCG if you're in primary care, so your own CCG digital lead, or send a question in and we'll do our best to get back to you. But we'll be out meeting with CCG digital leads over the coming weeks. In terms of clinical safety, this was a suggestion that actually came from a clinician around the clinical safety skills in the region, and the clinical safety case sign-off. So in order to build that capacity, we have run, we've invited NHS Digital. NHS Digital have been up to run their clinical risk management, CSO, clinical safety officer training in the Northeast. So 24 people, I think, were trained as CSOs, clinical safety officers, in September. We filled that course very quickly, so we're running it again on the 28th of January, and I think that one is full again, so we're going to run a 3rd round of the CSO training. If somebody in your organisation, most organisations will have a clinical safety officer, but to build that capacity, particularly again in primary care, please let us know. And also on our Discourse platform, there is a space for having clinical safety conversations and sharing documents. If somebody's done the hard work around some of this, let's share how that's working in different organisations. And the final note from me is about the Great North Care Record Network bursary, supporting skills, knowledge, confidence and capacity around digital, particularly around information sharing. The network has just launched this year's bursary, so there's a total fund of £1,500 that's open to network members, and you sign up to the network via the Discourse platform to support education, training and development. Now, that might be going on a course, going on a workshop, going on a conference. It might be, I'm going to say, books for the library. That's a subscription, should we say, an online, whatever it is that's needed for you or a team. And it's fantastic if you've got access to a training budget, but we're very aware that not everybody easily does. So on the Discourse platform, you'll find details now of how to apply for that bursary. And it might be a small amount, it might be up to the full amount, but obviously we're hoping to spread the impact that that bursary can have. Okay. I think we've probably covered that. That's the streams, and we'll send those out again.
Although they're there for the streams, but we'll put the due dates and the names against it. We'll send them out.
Okay. So the contact details there. I haven't put your mobile phone numbers on there, but people can get to you.
I think nearly everybody knows mine by now.
So please contact us, and that will that email address will get to any of us, whoever can have the answer to the question. So we've got a few more questions come in. Will HIE usage figures be shared with webinar attendees? We currently see MIG usage. I think that's a really great question.
Absolutely. Yeah. Absolutely. We've got a number of reports and statistics we want to share, even of where we are now. So we've got a nice pack that we've just put together that shows exactly where everybody's up to, graphically, as well as kind of lists, work packages, who's doing them, when they're due by, and then once we obviously transition to the live situation, we'll absolutely be providing those kind of stats of who's using what.
Okay. Somebody's just said about that's quite a recent Great North Care Record email address. So that should work. If you've got any problems with that as an email address, let me know. Mine is louise.wilson@ahsn.nc.org.uk. So between those two email addresses, but that one, I've got that email address on my mailboxes, so I think that one works. Somebody's just got a question about maybe they've used that and it's bounced before, so so you've got other routes there. Okay. Might have missed this, but as the HIE is currently primarily focused on direct care, is the IG work stream mentioned fully aligned to Journey 1 and 2 of the nationally defined and approved IG framework?
So I think they're referring to the LICRA framework, and we are working towards the LICRA framework, but I don't think we're quite aligned to Journey 2, but certainly Journey 1.
And I think
Journey 2, I think, specifically research, isn't it?
Yeah, so I think we probably need to be really careful around how we link things to Lycra. So this isn't part of Lycra. It's not, that the whole Journey 1, Journey 2 isn't part of this project. Just to be really clear as well, HIE is for direct patient care. That's the focus of this program. That's what it's been installed to do. What as a region we then decide to build on top of it and then enhance later on, and we may have we'll look at those three components, and one of them's all about research. That's not what we're building now, and whatever that may be, and population health approach isn't isn't the HIE that we're building now. HIE is about direct patient care, and we've been very, very clear with that with everybody we've talked to, and I think the IG leads again are very, very clear with that as well.
Okay. An offer from our MIG expert in Cumbria, Ian, thank you, about happy to discuss offline, he says, about embedding with MIG and about viewing extra data sets from Cumbria and about the sharing agreements that were already in place. Of course, the ISG was invented in the Northwest.
Thank you very much as always.
Thank you very much as always. Okay. Okay, well, I haven't got any other questions come in. That's the end of the questions that will come in. I'll just check on the chat function as well. And that's... Oh, thank you. One more. Brilliant. I am providing regular updates into the organisation on progress. Are the slides from this webinar going to be made available, and are the packs on progress to all member organisations imminent?
Absolutely.
Yeah.
So that's exactly why we produced a pack. I've talked to quite a lot of my peers around the region about how they're trying to get that message out within their organisations, and I appreciate it's been a bit of a struggle up until now, because although we're talking about what's happening, we haven't really provided anything to make that easy for people. So that's why we produce these packs that are just briefing packs that you can use in any which way you want, but they kind of build on the existing ones that Catherine's put together to say this is what it is and this is what it does, and now these packs are saying and this is where we're up to, and this is the progress so far. So hopefully they'll be really useful. As I say, we've just launched the first one of those, and we'll get them out to this group as well.
Okay, that's great. Thanks, Dan. And you mentioned Catherine Commons briefing packs there. Network members, so if you signed up on Discourse, and if you're not a Discourse member, I can send you a joining link, will receive the monthly updates, and they've been really well received, and people looking to then use those in local bulletins or organisational bulletins. But if there's something specific that you need, the animation, for example, has been really popular, people using links to that in waiting rooms and so on. But if there's something specific, I'm taking Catherine's name in vain here, but I know she'd be delighted for me to do that. Please do get in touch. How can we help you cascade those messages? And some of that will be broadly about the concept and the benefits, and some of it will be having specific conversations with different sorts of people in your organisations about what's needed and what steps are required. Yeah. So please do get in touch.
And that absolutely applies to the update packs as well. You know, if we're not giving you the right information, if you want some more in there, you know, clearly there's only so much we can give in an update pack every 2 weeks, so it won't be writing War and Peace. But as I say, at the moment, it's got a graphical representation of where people are up to, plans of dates and times of where we're going, our overall programme timeline, work packages for each stream and who's due and when they're due by. Have a look at it. If there's something else we can put together as a kind of key metric for people to measure and look at and see where they're up to, absolutely happy to help with that, and we can include those in the packs.
Brill. We're recording this webinar as well, so I'm sure we'll all be watching it back, won't we? So
well, I will after last time. God,
what happened last time?
I looked terrific last time. I didn't realise I was being recorded, but I was on my laptop and I was like sitting like this for the whole thing. I've been
very thoughtful.
I looked thoughtful, I suppose. Either that or just like half asleep. So I wasn't, I promised. So yes, this seems to be a lot better this time.
And these are regular sessions that are booked in, and this recording from this will be going out. So that will be coming out to everybody who's attending, and also a link onto the Great North Care Record Network Discourse space. And what would be useful? We've had so many questions in. I'm thinking that actually a Q&A would be great. So we'll speak to Catherine about programmes. So please do send your suggestions in about what would be useful for you. Okay, well, we've got to the end of the questions. Is there anything else, Jill or Dan, that you would like to add? Thanks, Ian, by the way. So enjoying the webinars. Well done.
The only thing we haven't really touched on is the portal. So obviously that's one of the other project. I know this is focused all around HIE, but just probably the same people that are interested on the call. Just let everybody know contracts have been signed, and we're about to start a pretty large piece of analysis and design sessions to work out exactly how it's going to look, how it's going to work. But you'll be getting contacts from us shortly to get people into those groups, because we know different organisations have different requirements. Obviously, that's a lot more focused around what patients want and getting patients groups to kind of design this product. But you know, it will be a pretty big design exercise, very very much heavier on that side than HIE is, of course, because this product doesn't exist yet, and for a portal we're building it. So you know, watch the space, I suppose, and hopefully the next one of these will be talking a lot more in detail around portal as well. Great,
thank you very much. Thank you to the panel. Thank you everybody for dialing in. Hope you found it useful. Look out on Discourse for the recording and slide decks. Please post any questions there. One of the benefits of having a platform like Discourse is that if somebody's got a question, everybody can benefit from hearing the question and hearing the answers. And we've got such a lot of collective expertise around this in the North East and North Cumbria. So it'll be great to share some of that. Please fill in the questionnaire that Catherine's going to send to you. And we'll see you next time. Thank you very much.